Hi, and thank you for tuning in. My name is James Danahay, and today I have the privilege of presenting on the work led by Dr. Naiem Nassiri to investigate the imaging and treatment capabilities of high-intensity focused ultrasound as it relates to incompetent veins of the lower extremities. Chronic venous insufficiency is a condition that affects the venous system in the lower extremities and causes a wide range of pathologies, including edema, changes to the skin, pain, and in some cases, severe ulceration. Etiology can be classified as either primary or secondary to deep venous thrombosis, but irrespective of the specific etiology, CVI promotes venous hypertension, distension, and valve failure. If left untreated, the disease is usually progressive. Due to its high prevalence and increasing cost of care, CVI presents a major burden to the global healthcare systems. In the United States, approximately $3 billion per year is used for treatment, with an estimated willingness to pay ratio of over $28,000 per quality adjusted life years. Furthermore, disability related to CVI attributes to diminished quality of life and loss of work productivity. Treatment can result in substantial improvements in symptoms and in the quality of life. However, despite the plethora of possible modalities, a clearly superior option is lacking. Percutaneous endovenous techniques are commonly employed, but are reliant on the administration of tumescent anesthesia and are associated with recurrence rates of over 30% in the 5-year period after treatment, often requiring reintervention. Furthermore, these techniques are unable to simultaneously address associated varicosities and perforator veins, necessitating additional treatments that increase the cost and time commitments to the patient. Given these limitations, a more definitive, durable, and comprehensive treatment option for ablation of incompetent superficial veins and associated tributaries is needed. High-intensity focused ultrasound benefits from being able to ablate targeted tissue within the body without radiation or surgical excision. By rapidly elevating the temperature of targeted tissue, leading to the disruption of lipid membranes, denaturation of proteins, destruction of vascular endothelial cells, and ultimately coagulative necrosis without damage to the surrounding or overlying tissue, key elements in achieving durable vascular ablation can be achieved. Our study used the Sonoblate HIFU probe system, which, while being specifically designed to ablate prostatic tissue, may also be used as a venous ablation, may also be able to be used as a venous ablation device. Currently, it is unclear if the ultrasound imaging functionality of the Sonoblate probe will provide the necessary imaging quality required to target, guide, and monitor the delivery of HIFU. Compared to existing treatments, benefits of this device would be that it forgoes the need for tumescent anesthesia and endovenous access, as well as having the capabilities to simultaneously treat the refluxing superficial vein and any affiliated varicosity or perforator vein. Given that future HIFU treatment and delivery will first and foremost rely on and require adequate B-mode visualization and identification of any targeted venous structure by the probe, it was imperative that this phase 0 pilot study be performed to determine whether or not the probe can adequately identify, visualize, and outline the veins needed to be treated. The primary endpoint of this study was to assess the adequacy of the probe for ultrasound imaging of the incompetent lower extremity superficial veins, as well as any associated varicosities and perforators if present, in anticipation of future HIFU treatment delivery. For this study, patients with duplex confirmed symptomatic lower extremity CVI who were scheduled to undergo surgery were enrolled. Prior to the planned surgical intervention, the Sonoblate probe was positioned to identify and ultrasonically image the targeted refluxing saphenous veins and any associated tributaries. Positioning was heavily influenced based on diagnostic duplex ultrasound achieved beforehand. And in this image, you can see an example of the positioning setup. Patients subsequently underwent surgical intervention and clinical follow-up per the standard protocol. For this study, 10 patients were enrolled. The age was 28 to 81 years. And in all of those patients, the Sonoblate probe was able to identify and ultrasonically image the incompetent great saphenous vein as well as associated perforators and varicosities. And here we have two examples of the study device imaging in a woman with May-Thurner syndrome who presented with lower extremity venous insufficiency. And as we can see from both longitudinal and cross-section, the vein is able to be clearly identified and outlined. So to conclude, the culprit refluxing great saphenous vein and associated tributaries, when present, were able to be ultrasonically identified and outlined with the Sonoblate HIFU probe in anticipation of future treatment, planning, and delivery. The preoperative diagnostic venous duplex ultrasound was essential for guiding probe placement and HIFU imaging. And then based on these findings, future studies will investigate the safety and feasibility of the Sonoblate HIFU system for the ablation of incompetent veins of the lower extremities. And in fact, this study is already in the works of receiving approval and will be started shortly. So thank you for tuning in. I hope you appreciated this talk and you have a wonderful day.